everyone, and welcome to the Mama Doc Baby Doc podcast. I am Rachel, a board certified pediatrician, and I'm here with my mother, Renda, who is a board certified OBGYN. Hey, Mom.
Hi, Rachel. we are so excited that you've joined us for another episode. I hope that you enjoy listening to us chat together as much as we are enjoying making these podcasts. We started making these podcasts because there is so much misinformation out there about pregnancy and birth and raising
Yeah.
babies.
Yep.
And this podcast allows us to share credible, evidence-based information to
Yeah.
help women make the best choice for their pregnancies and their children.
Yeah, that's right. That's exactly right. Pregnancy and the early postpartum period are very vulnerable times in a woman's life when she really
Yeah.
just wants to do what's best for herself and her baby. Many women are getting their including me, are getting their information from wellness influencers, mommy blogs, social media influencers. And, often the information that I'm seeing is just simply not true. Like, it's not even just like their opinion. They're just saying things that are not true.
Yeah.
So, in this podcast, we really made it so we could share practical tips and expert insights onto, like a wide range of topics from prenatal care, labor and delivery, having a newborn, and early childhood stages, and we use really credible scientific-based evidence to help you decide what's best for you.
Right. So in today's episode, we're going to talk all about vaccines and pregnancy. And, vaccines are important in order to help prevent moms and babies from getting lots of different types of infections and diseases. We're going to explain to you how vaccines work. And vaccines are also called immunizations, so I may use that term interchangeably throughout the episode. You're going to learn about the safety of vaccines and the big picture regarding vaccines and pregnancy. There are currently 4 recommended vaccines for pregnancy. We're going to discuss them, why they're recommended, and the risks and side effects, and things like that. And then also, we're going to discuss vaccines that are not safe during pregnancy.
Right. This is a huge part of my job, but there is a lot of controversy out there on social media, even nowadays, the news, and just politics has gotten into vaccines and, their safety and if they work. But, as doctors, and especially as doctors who have spent time working in third world countries, where vaccines are not always available, we have seen problems that can occur in a population that is not vaccinated. So, I do want to start out by saying that we, both Mom and I, are huge proponents of vaccines. We recommend them for our patients and we get them for ourselves and our children. Vaccines save lives and save children and adults from so many unnecessary illnesses.
That's right, yes.
Mm-hmm.
And I'm going to start by explaining how vaccines work. So, what vaccines do is that they introduce a weakened form of a virus or bacteria into your system. It's weakened so that it can't make you sick, but your body still is able to recognize it as a virus or bacteria, and then your body makes antibodies to fight it. So when your body actually does get exposed, or when your body potentially gets exposed to the actual virus or the bacteria in the future, it's already prepared to aggressively fight that virus and make or bacteria, and then it has antibodies that were already made, so it's ready to go. So the virus or the bacteria doesn't really have an opportunity to make you sick because those antibodies are already there and they're ready to go. Your immune system is primed. It's ready to go to work. There doesn't have to be that time for your body to make the antibodies to begin with.
Exactly. Yeah. So if you get infected with the actual virus or bacteria, you don't get sick, or you get less sick than if you didn't have the vaccine.
Right.
Viruses in general are very safe. Oh, sorry, my nose is itching. Viruses in general are very safe.
You mean vaccines? You mean vaccines are safe?
Oh,
Viruses
yes,
are
sorry.
not.
My nose was itching and it confused me. Vaccines in general are very safe. Not, I mean, viruses, it depends on the virus, but vaccines
Right.
in general are very safe. So by safe, I mean the chances of having any problems or issues that occur from you taking the vaccine are really low. And the benefits of having the vaccine really greatly outweigh the risk of any of the contra and any of the things that could happen, that problems or issues. That does not mean that vaccines are risk free, though. So, Mom, can you start by talking about some of the complications or side effects from vaccines?
Sure, sure. So I'll start by saying that adverse events do happen from vaccines, and that can be something as simple as a headache or fever or pain at the injection site. But there are rare, serious events like seizures. However, the benefits in general far outweigh any risks, and the chances of you having a serious complication from vaccines, it's just incredibly rare. Vaccines in that regard are actually similar to childbirth. The fact that they are safe and the vast majority of the time, just like childbirth is, the vast majority of the time, but sometimes bad outcomes can occur. And some other things to be mindful of in terms of safety. We cannot give live vaccines during pregnancy. We really only
Mhm.
give the inactivated vaccines. So
Yep.
there's no evidence of harm to pregnant women or to babies from any inactivated vaccine. However, live vaccines, meaning the bacteria or the viruses are live in the vaccination that you're getting, they could potentially be harmful to a developing baby. So we don't give those during pregnancy. And I'm going to talk a little bit more about that in a minute. Okay.
Yeah, and also in regard to safety, there is overwhelming amount of evidence that's available that does not support an association between vaccines and autism in children. There was one study that a man did a long time ago saying that there was a connection, which is where all of the misinformation is from. However, since then, he has been, and that study has been proven to be wrong and incorrect. And, they've done studies on two populations, vaccinated and unvaccinated kids, and there is no more incidence of autism in either population, vaccinated or unvaccinated. They have the same amount of autistic kids who uh, present in both groups. So this is a misconception, and I can't say it enough. Vaccines do not cause autism.
Right, right. And also, although there are some vaccines given to adults that contain thimerosal, which is a mercury preservative that's used sometimes in vaccines, there's actually no evidence that that mercury preservative containing vaccines will cause any adverse effects in babies or in women who receive these vaccines during pregnancy. They don't need to be avoided during pregnancy. Now, if you have concerns about that, you can check with the FDA and their website. They do have a list of thimerosal related vaccines, but there's really no evidence that these mercury containing vaccines are going to cause an adverse outcome.
Yeah, and on the same lines as that, I haven't deep dived into that to see if this is actually true, but what I hear is that the amount of mercury in a vaccine is similar to eating a piece of fish, like
Yeah,
salmon or something, not
yeah,
like the high mercury fish that you don't want to eat during pregnancy.
right.
So I mean, most people eat salmon once in a while,
It's
and so
pretty
the
healthy.
mercury, yeah, so the mercury, that amount is very similar. That's what I hear. I haven't looked into that on my own, but so now when we take a step back and look at the big picture regarding vaccines and pregnancy, actually the vast majority of vaccines are not given during pregnancy. There's
Right.
actually quite a few vaccines that are available in general, and most of them are not given during pregnancy. In fact, there's only 4 that are recommended during pregnancy, like you said. So tell us about the 4 that are recommended.
Sure. So the 4 vaccines recommended in pregnancy are the flu vaccine, the
Mhm.
Tdap vaccine, and
Yep.
now also the COVID vaccine and RSV vaccine. And those are the two newest ones. And you're going to learn more about those in a minute. There are also some vaccines that are specifically not recommended, but they could be given during special circumstances during pregnancy. I'm not going to talk a lot about those because those are uncommon circumstances like meningitis, yellow fever, rabies, things like that. Then there are some vaccines that really should not be given because they're not safe during pregnancy at all. And specifically, those are the MMR vaccine, which is measles, mumps, and rubella, and then the varicella vaccine, which is chickenpox. Those should not be given during pregnancy, and that is because these vaccines are live virus vaccines. And measles and rubella in particular, as well as varicella, can have really, really devastating effects in pregnancy. Measles during pregnancy is associated with an increased risk for serious maternal and also fetal complications. It can cause simple things like diarrhea and then pneumonia, encephalitis, and that is in mom. And in rare instances, I should say, not even that rare, one study showed that it was about 12% of pregnant women who had measles during pregnancy died during pregnancy. So that can be really significant. And then for babies, there's a risk of low birth weight, of miscarriage, of stillbirth. And so all of those things are potential issues related to measles and getting measles during pregnancy.
Yeah, we don't really see this very often anymore,
Right,
because measles, mumps, rubella is a childhood vaccine. So it's not very
right,
common that people aren't vaccinated against these things. And, as an aside, in general, we don't necessarily understand the importance of vaccines or underappreciate the importance of vaccines because we don't see the diseases that they cause anymore because so many people are vaccinated. I
right,
think mom and I have seen things, just like working in hospitals and around people who have been unvaccinated, but the general public, you guys don't get to see these things. When I worked at a
right,
hospital in Kentucky, we had a huge Amish community that was next to us, and the Amish people do not vaccinate. Some of them might, but this specific community didn't. And so I, working at the University of Kentucky, got to see a lot of these devastating diseases because
yeah,
their community was not vaccinated. So, if you haven't seen these things in real life, it's kind of hard to understand why vaccines are so important,
right,
which is why it's even more important to find a provider, a doctor that you trust, that you can ask questions about vaccines and they can tell you, because I feel like most physicians have seen these things in real life. Um,
right,
but, you know, so many people are vaccinated, and even if there are a few pockets of people who are not vaccinated, they're protected because the people around them are
right,
vaccinated.
right,
If you live in a community like the Amish community where everyone wasn't vaccinated, stuff's going to spread around. But if there's just one person in a community of people who is vaccinated, that person's protected because those diseases don't spread around the community
right,
like
right.
they would if everyone was unvaccinated. So vaccinations are a really important public health strategy to keep us all safe.
Right. So I want to give an example like the polio vaccine. We
Hmm.
all get the polio vaccine.
Yep.
Most people nowadays have never heard of polio, never seen polio. So I have. My uncle, my mother's brother, had polio when he was a child. I mean, he's old now. He has to be in his 80s. And he
Yeah.
had it as a young child. And as a result, he has walked with a limp his entire life, and it caused other long term issues for him health wise. Yeah.
Yeah, yeah, and then, I've done a lot of work in Tanzania where they're just
Right.
starting to vaccinate against polio, which
Right.
is really good, but everyone isn't vaccinated, and I've seen multiple cases there of, kids who, have, one paralyzed limb, and so they have to have
Right.
a walker or crutches, and, it's really devastating. But when you don't see those things, you don't necessarily understand the importance of vaccines and how they play such a
Right.
big role, in reducing the bad outcomes from diseases.
Right. Okay, so getting back to the impact of certain things on pregnancy, rubella infection can also have a really catastrophic effect on a developing baby. So you don't want to get rubella when you're pregnant.
Nope,
And
please
that's
do
why we
not.
don't give the live vaccine. It can result in miscarriage, stillbirth, growth restriction, and it can cause a whole bunch of congenital defects in the baby, particularly if the mom is infected within the first 16 weeks of pregnancy. It can lead to deafness, cataracts, heart problems. It can actually potentially affect almost every single organ. So you
Yeah.
really want to be vaccinated against rubella before you get pregnant. Okay, and
Yeah.
then chickenpox during pregnancy can be associated with some severe maternal complications. When I was a medical student, I took care of a pregnant mom in the ICU who ended up dying from a varicella infection during pregnancy. She got chickenpox while she was pregnant and ended up dying from that. I mean, it was incredibly sad. Um,
Yeah.
yeah,
I think most of us who are 30 years or older had chickenpox when we were younger.
yeah,
And so we know it was a rash, we know it was itchy, but we don't really understand how devastating it can be, because
right.
most people get a rash and it goes away. But, same with me. I've seen little kids, a couple Amish kids, and one kid from the Ukraine who had it horribly. It was in their lungs, and just really devastating. They had the potential to also die from it. So it's not just a rash. um,
Right.
so, and I also know that varicella or chickenpox can affect the baby. It can cause congenital varicella syndrome and what's called neonatal varicella zoster infection. Congenital varicella syndrome is where the baby can have scars and a specific pattern on the body. There can be a small head called microcephaly. There can also be the opposite, which is hydrocephalus or fluid on the brain, which leads to a bigger head. There can be seizures. There can be cataracts, issues with the eyes, even where the optic nerve is affected. Um, there can be issues with the limbs, intestinal system, the bowel, can be reflux, low birth weight. Congenital varicella syndrome actually has a really high mortality rate of 30%, which within the first few
Wow.
months. Yeah, I can't talk, but yeah, and a 15% risk of developing herpes zoster in your first 4 years of life.
That's
And
really sad.
it's not just that, but if a mom gets chicken pox after delivery, after having the baby, we sometimes will recommend quarantining, because if a baby gets like a newborn baby gets chicken pox, it can be devastating for the baby. So it's just not a good thing all around.
Yeah, yeah. And I know that the neonatal varicella infection can happen if the virus is transmitted from mom to baby just prior to delivery. Their risk of
Yeah.
having more severe infection at birth, as you might understand. If mom is sick, then there's a higher chance of baby having issues from varicella as well. Now, again,
Hmm.
most of us are going to have had these vaccines prior to getting pregnant. MMR is a childhood vaccine. Varicella has been given as a vaccine since the late 1990s, or you may
Hmm.
have been exposed to it naturally with varicella and chickenpox. I mean, when I was young back in the day, we didn't have a varicella vaccine, but you got exposed to it when your friends got it, because it was a highly communicable childhood disease. It was easy to catch. However, we do routinely check for immunity to those two things, to varicella and to rubella, in your standard prenatal labs. And most likely you're going to be immune to them. If not, then your OBGYN, your midwife is probably going to recommend that you get those vaccines after you give birth, but before you leave the hospital. And that's to help keep you from getting it and getting the infection and giving it to your baby.
Yeah, and your pediatrician or whoever is taking care of baby after looks at all of mom's prenatal labs, and we specifically look for if mom is rubella immune or if they're chickenpox immune. We look for that
Yeah.
specifically. So everyone cares.
Yes.
Okay, so that's the first step for protection. Get vaccinated against measles, mumps, rubella, MMR, and varicella, the chickenpox vaccine, before pregnancy. And then during pregnancy, those 4 vaccines that you recommended. Tell us about those.
Okay, great. So, in general, when you're pregnant, your immune system is just not as quick to respond to illnesses as when you're not pregnant. Your body's busy growing a new human, so it can't do everything, and your immune response is much slower. Your body knows that the pregnancy is okay, and we don't know how exactly a body perceives that the pregnancy is okay and that this foreign thing inside of you is okay to be in the body. But if it didn't, then your immune system would actually attack the baby. So thankfully, that does not happen. We think that it's related to the hormones and the placenta, but your body knows that it should not attack the baby and consider it foreign. It should not reject the baby. But in order to do that, your body naturally lowers your immune system's ability to protect you and respond to illnesses so that it can create a welcoming environment for your growing baby. However, that lowered immune system means that you are much more likely to catch viruses and they are more likely to have a bigger impact, a more negative
Yeah.
impact
Yeah.
on your body and your health than if you were not pregnant. So it doesn't mean that it's always going to be bad. It just means that the chances are higher of you having complications than if you were not pregnant. Okay. And that's with any of
Yeah.
these infections.
Yeah, and if you've ever been pregnant, you probably know you get sick, and when you get sick, it gets bad. I had like pink eye, like couldn't talk, bronchitis. Like at my baby shower, I had like pink eye, I had to wear my glasses. It was bad. So
Yeah.
yeah, if you've been pregnant, you know that that's true. So let's first talk about the flu vaccine. And the flu or influenza is a virus. It can actually cause a pretty serious illness. It's more than just a runny nose and a sore throat.
Right. The flu can make you quite sick, and it can be especially harmful if you get it during or right after pregnancy.
Yeah, and it spreads really easily from person to person. When someone has the flu and they cough, they sneeze, even if they talk, the virus can spread through the air. And you can get infected with the flu virus if you breathe it in, what they're coughing out, or if you touch something, like if they've coughed in their and that lands on a doorknob. If you touch a door handle or a phone or a counter that has the flu virus on it, and then you touch your nose or your eyes or your mouth, you've just infected yourself. The flu virus can actually survive on hard surfaces like a countertop for 24 hours.
Wow. And now, in terms of complications from the flu, pneumonia, which is a potentially serious and even deadly complication from the flu, can happen. And it can be worse if you're pregnant. You're more likely when you're pregnant than other adults to have those serious complications. It's more likely to affect your heart, more likely to affect your lungs. Another reason the flu can be harmful during pregnancy is that your lungs need more oxygen, especially in the second and third trimesters. But your growing belly is kind of in the way. It's as the baby gets bigger, it pushes everything up under your ribs and pushes up on
Yep.
your diaphragm. And that puts a lot of pressure on your lungs. So they have to work even harder and in a smaller space because your baby's taking up more space in your belly and in your
Hmm.
chest, even. And a lot of pregnant women feel shortness of breath normally during the end of their pregnancy. And it's just because there's not as much space in your lungs, so they have to work harder. And your heart, it's also working harder, it's pumping extra blood. And that's a bit of stress on your body during pregnancy. And then if you get the flu on top of that, it can increase the chances of you getting serious complications. If you're pregnant and you get the flu, you're more likely to have preterm labor. You're more likely to have a preterm delivery. And that's defined as labor or birth before 37 weeks gestation. And then that really high fever that can happen from the flu can be linked to birth defects like neural tube defects. Those are defects of the brain and spinal cord and potentially other problems for your baby as well.
Yeah, I remember when I was so sick and I was having fevers too, and I haven't had fevers in years. I was really worried about how it was going to affect the baby. But, he ended up fine, but you just never know. Um So, I want to talk a little bit about the flu shot or the flu vaccine. The flu shot contains a vaccine that helps prevent you from getting the flu, right? It
Right.
does not cause the flu, and it's safe
Right.
to get at any time during pregnancy. Um, Ideally, it's best to get it before flu season, which is October through May. But even then, you're more likely to get the flu during flu season. You can actually get the flu any time of year.
Right.
There are lots of different flu viruses, and the flu virus is always changing. Every year, a new vaccine is made, so that it's really just the best guess of the most popular or the most prevalent strains of the flu that are
Right.
suspected to be present for the year coming up. So that protection from the flu shot only lasts about a year. Every year, the flu vaccine is updated.
Right. And it is really important that you get that flu shot every single year. And you can get it from your OBGYN's office. You can get it at pharmacies. Most
Hmm.
pharmacies offer vaccines these days, whether it's CVS, Walgreens, or whatever. And even a lot of workplaces will do
Yeah.
vaccines in the fall. It's considered very safe. It's been given to millions of pregnant women over many, many years with excellent safety record, and it's recommended. It's recommended by the American College of Obstetrics and Gynecology to be given to all pregnant women. Now, some that cannot be given during pregnancy because it does contain the live virus. It contains a
Hmm.
live virus vaccine. And we said earlier, we do not give pregnant women live vaccines. Now, in addition to the benefits of helping you not get the flu, there are also positive benefits for your baby as well. When you get vaccinated while you are your unborn baby. So, you getting the flu vaccine can actually help protect your baby for up to 6 months after you give birth from those antibodies that you make and are passed through the placenta. The flu shot can also be given if you're breastfeeding, and it is safe for mothers who are breastfeeding. And those antibodies also can pass through breast milk as well.
Yeah, exactly. Side effects from the flu vaccine, they can include
Yeah.
soreness, tenderness, and redness where the shot was given. So, like an injection site reaction. That's true for most vaccines. And all of those side effects are very common, but they only last a couple days, 1 or 2 days. Um, but some people may feel achy for a few days. But the main thing to know is that you will not get the flu from the flu vaccine.
Right.
um, okay,
Right.
next next recommended vaccine is Tdap. Let's talk about that one.
Right. So Tdap stands for tetanus, diphtheria, and acellular pertussis. That vaccine, they're all given together in one vaccine, and it is to provide primarily protection against pertussis, which is whooping cough. So the prevalence of pertussis or whooping cough in the United States has been increasing, and that's because immunity wanes over time after the vaccination is given. Immunity doesn't last forever. Also, there is a higher population of people choosing not to vaccinate. Where I live, we also have a community of people who don't vaccinate, and we commonly see babies brought to our hospital with whooping cough that have to be
Mhm.
medevaced to a larger hospital with a pediatric intensive care. So adults who develop pertussis, they're just going to cough and they'll be fine, but they can transmit pertussis to susceptible babies in the household. And it's a concern because infants or babies who are under the age of 3 months in particular are at the highest risk for having problems from pertussis. And the pertussis vaccine isn't even recommended until 2 months of age.
Yep. So also, right now everyone's terrified of RSV. RSV is so scary for babies. But before we were vaccinating, pertussis was a thing that everyone was scared
Right,
of. All the babies
right,
would be hospitalized for this. It was very scary. And for similar reasons, they're coughing, they're having trouble breathing, they're needing help breathing, whether that is nasal cannula or CPAP or even intubated. Some babies have to be from
right,
pertussis But since we've been vaccinating and we vaccinate moms, I've never seen a case hospitalized in the US. I saw one in Tanzania, but we've done this huge thing by helping babies so that they're not having to be hospitalized for this. So it really is a huge deal, this vaccine.
Right.
But anyways, you have a period of time where babies are really susceptible, potentially to have
Yeah.
complications from it. Not that they're going to have complications, but there is a higher risk. Now, in terms of the effects of whooping cough, it can be that distinct cough. There was a commercial on TV. Do you remember it? It
I
had
don't.
the cough. It had like the whooping cough because it was the commercial for the vaccine. And anyways, it's like a very distinct cough that you cough when you have whooping cough, but you can Google the sound of it. I'm not going to try and do it for you. It's very startling. um, it can last for 2 to 8 weeks. It's really violent though, and it can cause gagging. The baby can turn blue, struggle to breathe. They can cough so hard they can vomit. And
Right.
recovery takes forever. It's actually, the nickname of it is 100-day cough,
Oh,
because you will cough for just ever, cough for 100 days. Um, and there can be more serious complications that can develop, including poor weight gain, pneumonia, seizures, and they can even have fatal consequences. Unfortunately, babies can die. Over 50% of infants actually who get pertussis get it from a family member,
right.
most often from their mother. So that's why
Right.
vaccination of mom, you as the pregnant person, is really important. But other household contacts should be vaccinated as well. Um, the vaccination is really going to significantly decrease the risk of your baby being exposed. And then also, you'll get that placental transfer, like we talk about, of those maternal antibodies, which are highly effective in protecting your baby against pertussis in the first few months of life. Remember, your baby can't get that vaccine until 2 months of life.
Right.
So it's really important that you get it to protect your baby. The antibody transfer that we talk about is really critical in helping protect them against pertussis. So you should get the vaccine ideally between 27 and 36 weeks of pregnancy. That's going to maximize the amount of time for your body to develop the antibodies. So then you can then transfer the antibodies
Right.
across the placenta to your baby.
Right. And then the Tdap vaccine also offers protection against tetanus. Now, that is not as much of an issue in the United States, which is a more highly resourced country. But in more developing countries where children don't routinely get tetanus vaccine, that can be more of an issue. But it does offer protection against tetanus as well. Now, if for whatever reason Tdap is not given during pregnancy, then we will recommend giving it immediately postpartum. If you have not previously received Tdap, and that can provide some protection for your baby through breastfeeding, the antibodies will transfer in the breast milk as well. But the immune response just is not as strong as if you get the vaccine during pregnancy, and it may not be as rapid or fast enough to provide protection until a couple of weeks. So there's going to be a couple of weeks period if you get it after pregnancy where your body is building up immunity. So there'll be a gap or a delay, or a period of time when your baby really isn't protected if you didn't get the Tdap during pregnancy. Now, as I mentioned, Tdap is recommended for family members, for child
Yeah.
care providers, anybody that you expect is going to have close contact with your newborn, and anybody who's younger than 12 months of age and they have not received the Tdap vaccine previously. You, any of your children, if they're going to be around someone who hasn't been vaccinated, just ask them to be vaccinated. So definitely grandparents, because grandparents probably haven't had that vaccine in a while. Anybody who's going to be around baby a lot should get the Tdap vaccine, until your baby can get their own pertussis vaccine. Pregnant women are the only population where we recommend repeating it in pregnancy. So most people will get the Tdap vaccine about every 10 years. But
Mhm.
I don't care if you were pregnant last year and you got the Tdap then, I'm going to recommend it again in this pregnancy. And that's because it builds up those antibodies so that you can get a good transfer of antibodies over to baby. Now, household contacts, they don't have to get it every time you get pregnant because their immunity is good for about 10 years, but it has to build up a high level of antibodies in order to transfer to the baby every time. So that's why moms are recommended to get it every time.
That's good to know. Also, on a side note, if you are wanting to get it for your child, if they are under 7 years old, you're going to be getting the DTaP vaccine, which is the
Yeah,
same as the Tdap in adults. The DTaP just has more. It's based off, the order is based off of what is mainly in the vaccine. Like there's more diphtheria in the DTaP, and the Tdap has more tetanus in it. But bottom line is, under 7 years old, you have to get the DTaP, and that has the pertussis in it that's going to be protecting them. Okay, so let's talk about the two new vaccines in pregnancy that came out the last few years, the COVID vaccine and RSV vaccine. So, first up, COVID vaccine. We know from lots of evidence that COVID during pregnancy can have significant effects on both you as the person who is pregnant and your baby. So, talk
right.
about that, Mom.
So some of the potential effects that pregnant women can have, when you're pregnant, you're at higher risk for developing severe COVID compared to non-pregnant folks of the same age. And again, this is because of that immune system effect that we talked about earlier. It's going to increase the likelihood of requiring hospitalization, intensive care, needing to be intubated, or having that mechanical ventilation. Pregnant women with COVID also have a higher risk of death compared to non-pregnant women with COVID who are at the same age. Now, I want to be clear that the absolute risk of dying from COVID or getting severe disease from COVID is still really low, but it is significantly elevated during pregnancy compared to the general population. And if you have a pre-existing condition like high blood pressure, diabetes, or if you carry extra weight, if you're considered obese, then you're at an even higher risk of getting those severe complications if you get COVID while you're pregnant. Now, when we look at potential effects on the baby, COVID during pregnancy does increase the risk of preterm birth. There are also studies that suggest that COVID can increase the risk of growth restriction where the baby doesn't grow as well. We think that it affects the placenta, causing it not to function as well. There's also evidence to suggest that COVID can increase the risk of stillbirth, and that risk is higher in cases of severe COVID, particularly when there are complications like pneumonia. And vertical transmission, meaning passing the virus from mom to baby, that's very, very rare, but it is possible and it does happen.
Yeah, and there are a handful of newborns who have tested positive for COVID shortly after birth when their mother had it. And the long term effects of that are really still being studied. We just don't know yet.
Right,
Speaking of long term effects in general, the long term effects of COVID on children who are born to mothers who had COVID during pregnancy, we also don't know really that yet
right,
either. There's just not been enough time to understand what those potential long term effects are. There are ongoing studies that are tracking developmental milestones, immune responses, and overall health of babies where moms had COVID during pregnancy. So we'll have more information soon, but it's just going to take time. Given the increased risk for both moms and babies of COVID during pregnancy, it's strongly recommended that pregnant folks take preventative measures, including getting the COVID vaccine to reduce the likelihood of severe illness and protect their babies as well. I mean, even when I was working in a hospital, I saw many people, many pregnant women have devastating effects from COVID. So,
right.
um, yeah, yeah, it can be
Yeah,
very bad.
so get your vaccine. And there has been an extensive amount of research in large numbers of women looking at the safety of COVID vaccine in pregnancy. And multiple studies have shown that COVID vaccines, including the mRNA vaccines like the Pfizer vaccine, the Moderna vaccine, they're safe in pregnancy. And the CDC, the World Health Organization, ACOG, they all are going to recommend COVID vaccination for pregnant patients. And it helps protect both the mother and the baby from severe illnesses, from complications, preterm birth related to COVID. pregnant women who get the vaccine develop a strong immune response similar to that of non-pregnant women. And those antibodies that are generated by getting the vaccine pass through the placenta to the baby, providing protection to the baby. The vaccine is recommended at any stage of pregnancy, including the first trimester. It is safe to get if you're planning on getting pregnant. The side effects of the vaccine are similar to those in the general population. You could get a soreness at the injection site, fatigue, sometimes a mild fever. There has been no evidence of any increased risk of miscarriage, stillbirth, or other adverse pregnancy outcome related to getting the COVID vaccine. Now, COVID vaccine is also considered safe for breastfeeding, and the antibodies that are generated and passed through breast milk may provide some additional protection for your baby. Now, of course, I will acknowledge that just like we don't know the long-term effects of COVID when moms actually, we don't know the long-term effects of COVID on anybody quite yet, but we don't know the long-term effects of mom getting COVID during pregnancy and how that can affect the baby. We also don't know the long-term effects of getting the COVID vaccine during pregnancy, and if there are any long-term issues for moms or babies from getting the COVID vaccine during pregnancy. We don't suspect that there are any, and we don't suspect from other vaccines that there will be any long-term issues. But again, honestly, we haven't had enough time to study that. So there are ongoing surveillance programs in order to continue to monitor the safety of COVID vaccines during pregnancy. The CDC maintains a registry. It's called vSafe. If you've gotten any of the COVID vaccines, you've probably gotten messages from them. It's a COVID-19, they have a pregnancy registry to track outcomes in pregnant women that get vaccinated. Okay, then the last vaccine that is now recommended during pregnancy is RSV. So Rachel, tell us a little bit about that.
Yeah, that stands for respiratory syncytial virus, and the RSV vaccine is recommended during pregnancy primarily to protect your baby from severe RSV vaccine or RSV infection. And that's because RSV can cause quite serious respiratory illness in infants, including bronchiolitis, which is inflammation of the bronchioles in the lungs, and pneumonia, which is the actual lung tissue. And that can be life-threatening. Newborns, especially those who are younger than 6 months, are at higher risk because their immune systems are not fully developed. And what happens is when a pregnant woman, just like other vaccines, when you're pregnant and you receive the RSV vaccine, you produce antibodies against the virus. These antibodies are transferred to the baby through the placenta and provide the newborn with what's called passive immunity during the first few months of life. That time is really important because that's when they're most vulnerable to severe RSV infection.
Right. And studies have shown that when you, as a pregnant mom, get vaccinated against RSV, it significantly reduces the risk of RSV related hospitalization in infants. Similar to Tdap, the vaccine is typically recommended toward the later stages of pregnancy. And for RSV, we recommend you get it between 32 and 36 weeks to maximize the amount of antibodies that are passed to the baby before birth. Now, be mindful that the vaccine given during pregnancy is called Abrysvo. There's another vaccine out there that's not given during pregnancy, and it's actually not a vaccine. It works a little differently. It's called a monoclonal antibody. So it's actually the antibodies themselves, whereas Abrysvo is a vaccine that's designed to elicit your immune response. And it's designed specifically to be given to pregnant women in order to protect their baby from severe RSV by providing them with the immune response through the transfer of maternal antibodies.
Okay, so I had Abrysvo when I was pregnant. So I know that it is a single dose given towards the end of pregnancy, and I was so excited to get it. The
Yeah,
timing is
yeah.
chosen to maximize the transfer of antibodies, like you said, from mom to baby. Large studies have shown that it is quite effective in reducing the incidence of severe RSV related infections and hospitalizations during the first 6 months of life. So that doesn't mean that your baby might not get RSV at all, but it's not going to be as severe. Again, extensively studied in pregnant women and found to be safe for both mothers and babies.
Right. And common side effects are similar to other vaccines: mild pain at the injection site, some fatigue, maybe a headache. I will also acknowledge that this is a newer vaccine, so we don't have the long term follow up studies yet. There are long term follow up studies ongoing to monitor the health outcomes of both mothers and babies after vaccination. And I will acknowledge that we just don't have that long term data yet. The data that we do have, though, is very reassuring. There hasn't been enough time to get the long-term data yet. And if you want to know some other preventative measures, just to prevent diseases in general, it's simple things like hygiene, wash your hands. That's going to be so important to help your baby stay healthy.
Right. So whether that's RSV, whether that's pertussis or the flu, really any infection, make sure everyone who touches your baby washes their hands. Um, you have to have the hand sanitizer around. Frequent hand washing, obviously, avoid close contact with sick individuals, disinfect surfaces, all these things. This is going to be particularly important within those first few weeks of life. And as the baby gets older, definitely past 6 months, yes, the risk of things is there, but it's going to start to decrease. This is really important within those first few weeks, actually more when their immune system is developing. Some other strategies that you need to do are just limit the baby's exposures to large groups of people. You want to limit, if you can, a huge daycare or crowded public places within the first few weeks of life. Obviously, keep your baby away from people who have any cold like symptoms, like my mom right now.
Like me. Yeah.
These are just common sense measures, but they really help. Breastfeeding can also help. Breastfeeding also provides babies with antibodies, with immune boosting factors that can help protect babies against infections. And then one final thing is you can always use a humidifier to maintain optimal humidity levels in your home. That can help keep your baby's airways moist, and that may reduce the risk of respiratory infections.
Okay, so the last thing I'm going to do is quickly touch on vaccines that are not safe at all during pregnancy, and one is HPV. So if you happen to get the HPV vaccine and then find out that you're pregnant, oh my goodness, this is bad. No, there are no known harms, but really we just have not studied it in pregnancy. It's never been studied in pregnancy. It's not a live vaccine, so we don't anticipate there to be issues. But again, just because it hasn't been studied, we don't know, so we don't give it. But if you happen to get it while you're pregnant, do not panic. It's probably fine, but you should just finish the series after you deliver. And if you started the series before you get pregnant, then you can just finish it after you deliver. You do not want to get the varicella vaccine during pregnancy. That's a live virus, and the live virus vaccine increases the risk of potentially infecting the baby. So you don't want to get varicella. You also do not want to get MMR because that's also a live virus vaccine. There have not been reported cases of issues in newborns or mothers who receive a live vaccine during pregnancy, not significant number of cases, but there have been what's called subclinical infections, where infections have been documented, just a low level of infection. So to be safe, we just avoid live vaccines during pregnancy because we don't want to take any risk, right? We don't want to take
Yeah.
that risk.
Yeah, exactly. Okay. So, just to recap, vaccines work by giving you an inactive form of a virus or bacteria. Your body forms antibodies to it. And then, if your body is exposed to the actual bacteria or virus, your immune system is ready to go with the antibodies. So, you either don't get sick at all or you get less sick than if you hadn't got the vaccine.
Right.
Also, vaccines are safe in pregnancy. The four vaccines that are recommended are flu, Tdap, COVID, and RSV. All of those vaccines are considered safe in pregnancy, and vaccines in general are all safe. All of the, I can't talk today. All of those things can cause issues in pregnancy, potentially severe issues, even if they're rare, and that's why they're recommended in pregnancy. Now, before pregnancy, you want to get that MMR and varicella vaccine to prevent measles, rubella, and varicella in particular. All those can actually have quite devastating effects during pregnancy. You cannot get live virus vaccines, those things during pregnancy, because they're not safe during pregnancy. Right?
Great summary. Okay, great summary, Rachel. I think that's all we have for today. So remember to share this podcast with a friend. Also, subscribe to the podcast wherever you're listening to me right now and leave us a review on Apple Podcasts. We'd love to hear what you think about the show. You can also send us any questions that you have, any thoughts, any comments on Instagram. We're on Instagram at MamaDocBabyDoc.
So that's it for this episode, but come back next week and remember that you can have a beautiful pregnancy and birth. Bye for now.
Bye.